your HIV का कुछ discussion. Yes? Okay. Now guys, if I talk about a normal child, like people like us, or mother is HIV positive and child is also HIV positive. Exclusive breastfeeding for 6 months. After 6 months, breastfeeding plus complementary feeding. Breastfeeding stopped at maximum 2 years. Plus give all vaccines. Yes, no problem in this. Now, if you see a mother who is HIV positive and child is also HIV positive, we will follow feeding guidelines same. No difference in the feeding guideline. When we talk about vaccine, give all vaccines except live attenuated, which is contraindicated. So you cannot give the live attenuated vaccine because it is contraindicated. This is the only difference which you will see in a HIV positive child. But the main confusion happens when mother is HIV positive, child HIV status is not known yet. So feeding. In India, there is no contraindication for exclusive breastfeeding, because if you do not do breastfeeding, forget HIV, the child will first die of malnutrition. So in India, we will give exclusive breastfeeding for 6 months. After this, at 6 months, we will go for breastfeeding plus complementary feeding. At 1 year, we will do PCR, HIV negative, HIV positive. HIV negative, stop breastfeeding. HIV positive, continue breastfeeding till 2 years. Yes guys, no problem with this. Absolutely clear. So we started with exclusive breastfeeding at 6 months. At 6 months, we went for breastfeeding plus complementary feeding. At 1 year, we did the PCR of the child, HIV negative, then stop breastfeeding, HIV positive, continue the breastfeeding till 2 years. When we talk about vaccines, all are given. There is no contraindication per se to giving the vaccines. Live attenuated, not given only if the CD4 percentage is less than 15% or child is clinically or child is clinically showing signs of HIV. Otherwise, कोई change नहीं. We are going to continue with the vaccine the way we would have given. ठीक है, यहाँ तक clear? No doubt, everyone is clear with it. Now, there is something called as EID. What is a EID? Early infant diagnosis. So when we talk about diagnosis of HIV, any person more than 18 months of age, the investigation of choice is Western blot. This Western blot picks up the antibody less than 18 months of age. The investigation of choice is PCR because this picks up viral genome. Because if I do a Western blot for a less than 18 months of age child, this will pick up maternal antibody and gives a false positive result. Okay, so it won't work at all. Yes, looks fine. This EID is done earliest at 6 weeks, 6 months, 12 months, 6 weeks of stopping the breastfeeding, and 18 months. So two timelines which are important for us is 6 weeks, which is the earliest diagnosis, and 8 months, which is the final, 18 months, which is our final diagnosis. Yes, guys. Now, we talk about prophylaxis in HIV. So when we talk about prophylaxis, we divide the child into a low risk and a high risk. So if the child is low risk, which means mother on ART, not on ART, and the viral load less than 1000 copies, here more than 1000 copies. So in a low risk child, we will give nevirapine for 6 weeks minimum, as we have already discussed that minimum will be 6 weeks, maximum will be 18 months, because at 18 months you are sure that at the end of the day you are going to have the HIV negative status. If the mother is not on ART, in that case we give nevirapine plus zidovudine. Now, if the child is on exclusive breastfeeding, it will be minimum of 12 weeks. If it is exclusive replacement feeding, it is 6 weeks. Now what is replacement feeding? Dabbe ka doodh. When we talk about the maximum for both cases will always stay as 18 months. There is no change which is going to occur in this. So I'm again repeating over here. So we will do a EID, early infant diagnosis. Normally the diagnosis of HIV less than 18 months of age, we are basically doing the investigation of choice as Western blot, where we are looking into antibody. If it is less than 18 months of age, then the investigation of choice is PCR. Why don't we do a Western blot in less than 18 months of age? Because it will have maternal antibody giving a false positive result. The PCR basically gives a viral genome, so it is good. The schedule is to do it at 6 weeks, 6 months, 12 months, and 6 weeks of stopping breastfeeding, and then ultimately 18 months. Guys, two timelines, 6 weeks and 18 months are important. We look into prophylaxis, low risk, high risk. Low risk, mother is on ART. Second, viral load is less than 1000. High risk, not on ART or more than 1000. If it is low risk, we only give nevirapine for 6 weeks minimum. If it is high risk, we give nevirapine plus zidovudine. Exclusive breastfeeding, 12 weeks. Exclusive replacement feeding, minimum is 6 weeks. Maximum for both will be 18 months, because at 18 months we are sure the child does not have HIV. So guys, this is the ultimate flowchart. If you see, this is not available in any other platforms or app. I have given you at one place to give you a absolute clarity on how we are managing a child whose mother is HIV positive but child status is unknown. Now, I'll wait for a couple of minutes. Anyone has any query, please feel free to ask. I have put up the entire flowchart for you to have a look and get an idea what exactly are we doing over here. Okay, no problem. Yes, done. Anyone has any query, please feel free to ask. As I mentioned, it is not available on the part. एक्सक्लूसिव ब्रेस्ट फीडिंग है तो 12 हफ्ता मिनिमम देना पड़ेगा, बिकॉज यू अंडरस्टैंड व्हेन वी आर हैविंग द ब्रेस्ट फीडिंग एट दैट टाइम द चांस ऑफ स्प्रेड ऑफ HIV फ्रॉम मदर टू चाइल्ड इज देयर. रिप्लेसमेंट फीडिंग देयर इज नो चांस, इसीलिए वी आर डूइंग इट फॉर 6 वीक्स. आई होप आई एम क्लियर विथ इट. यस, अंगद वीक्स नहीं समझा, कहां पे नहीं समझा, प्लीज फील फ्री टू आस्क गाइस. यस, डन. 6 weeks, 6 months, this is the age of the child. Okay, so basically when the child is at 6 weeks, 1.5 saal. Yes, done. Maximum is 18 months for both. The very basic reason is, you can see at 18 months we are finally doing the PCR and we say, boss, bacha, you do not have HIV. So before 18 months we cannot say a child whose mother is HIV positive that you are negative at all. Positive we can say early, but for negative you have to wait till 18 months. I hope I am clear with this. Everyone in the class, any other queries? Is this okay to all of you? Okay, this is the ultimate flowchart if you ask me when I talk about this particular topic. Anyone has any query? Anyone has any query? Done. No problem. Looks fine. Yes. वो बाद में देखेंगे, अभी रुक जाओ. ठीक है, जितना पढ़ा है पहले उस पर देखते हैं. ठीक है. Yes, everyone is clear. Yes, no issues. Great. Now